Welcome back to the final part of this demonstration of the all-test DSD-8127-C new triangular barrel chamber 12 drug including alcohol. Now what we've done is run this test now for between 5 and 10 minutes, and what we're going to show you first is the interpretation of the alcohol reading. The pad here, you can just make that out, I think, if I bring it into focus. This pad here on the alcohol test membrane. Now, supplied with each test will be a evaluation colour chart. Now this is a universal card used for the full 6 adulteration tests which are on urine packs, but also the saliva alcohol test which we have here, and it basically is a comparison of the colour change against these charts to read the indicative equivalent blood alcohol level. And you see this is a negative test where the match is with the normal or negative alcohol reading. And then if we come to the drug tests, we've got 2 rows of these, and you'll see on this first row next to the alcohol you've got THC, followed that by benzo, methadone, PCP and cocaine. And you'll see along the top you've got your control lines. They vary in density and colour saturation, and below that, nearest where the sample ran through, you've got your test lines. And again, you'll see quite a bit of variation in these, but these are all negative results. You've got faint test lines for both methadone, PCP, cocaine, and then the cannabis and benzos, stronger negative test lines. If we roll that round onto the other 6 matching membranes on the other aspect of this panel, again, you've got a fully negative test result here with nice, clear control and test lines against each of the drug abbreviations. So that is a complete negative screen for those 11 drugs plus the alcohol, making a 12 drug saliva barrel test. Takes in total between 5 and 10 minutes. Sometimes you'll get your test lines coming up much quicker than the 10-minute read time. As long as they are clear, that is fine to read earlier and interpret all your results as negative. You do have to give the full 10-minute development time for any positive results to show, and make sure that there is no test line showing against those abbreviations. Even if it's just a partial or very thin or faint line, that must still be interpreted as a negative result on these tests. So there you have it, the new DSD-8127-C demonstrated for you. These are going to come on catalogue probably towards the end of May, early June 2019, and they'll run alongside the existing 8127 and other barrel screens in our all test drugs saliva catalogue.